Academic Supports for College Students with Serious Mental Health Conditions video series. Students with mental health conditions often experience challenges that can affect academic performance. Video 1. College Students with Mental Health Needs, Framing Mental Health Conditions. A mental health condition is a condition that affects a person's thinking, feeling, or mood. Such conditions may affect someone's ability to relate to others and function each day. Each person will have different experiences, even people with the same diagnosis. Depression and anxiety are commonly experienced by college students. 63% felt overwhelming anxiety in the last 12 months. 42% felt so depressed that it was difficult to function.
As a college student, I think I've often run into the misconception that college students just don't have mental health conditions, or it's just anxiety, but people don't really understand the level of what type of anxiety and how debilitating it can be. I also think there are some days that, from a depression standpoint or more personality-based, motivation is just not there. And some people see it as like, okay, I'm not motivated. But with a mental health condition, it's just another layer of physically I can't, or it feels like I can't. So it's just navigating sort of the severity, I guess.
A common misconception about mental health conditions, specifically within the college setting, is that they make you weak, or that they make you not as capable as others, or that you have a one-up on someone, or that you know, if you have accommodations, that you have an advantage over other people. And these are all misconceptions that are deeply rooted, in ableism, in seeing folks that do have mental health conditions or disabilities as lesser than, and how the system has painted any sort of accommodation for folks who are neurodivergent, who do have disabilities, as any type of assistance to them as a blessing, as something that they didn't deserve in the first place. When in reality, I think to a certain degree, we could all use individual types of learning, individual types of care. And so I appreciate that these misconceptions, bring up conversations like this, and that we're able to deconstruct what these ableist systems imprint on us.
A primary misconception about mental health conditions is that, one, it impacts in extreme ways people's cognitive capacities. And while the actual treatment and side effects of treatment can, and sometimes the illness can, that is not a uniform experience for all people who live with mental health conditions. Another sort of myth around mental illness is that people are dangerous. And again, it's actually, the data is just the reverse of that, is that many people with mental health conditions are often victims of violence and crime. And while there are the very small percentage of people who, when they're really unwell, can be dangerous, this is, in most cases, is not true. The other big misconception about mental illness, and we often talk about this as kind of like death by diagnosis, is that your diagnosis does not predict your outcome in life. And so getting a mental health diagnosis does not sort of or prescribe what's going to happen in your life. People do recover, and they recover in terms of their symptoms, and they recover in terms of their roles and their ability to live the kind of life that they want to live. So many people can learn to live very well with a serious mental health condition, with good treatment and access to good treatment.
Myth: mental health conditions are uncommon. Fact: 1/5 of Americans are diagnosed with a mental health condition in a given year. Myth: mental health conditions are caused by personal weaknesses. Fact: mental health conditions are caused by environmental and/or biological factors. Myth: people fake mental health conditions for attention. Fact: no one chooses to live with a mental health condition. What they are experiencing is real, even if it is not visible. Intersectionality and mental health. Students experience mental health conditions in combination with their other identities, including race, gender, religion, and sexual orientation.
Okay, so a great question. What are the key ways that culture and identity influence the perspectives and experiences of a mental health condition on a college campus? So they absolutely do influence a person's experience of a mental health condition. There are many cultures that view help seeking for a mental health condition as a weakness. And so if you are from a culture or a country that perceives mental illness as a source of great family shame, those students are going to be reluctant to seek help, especially at the beginning when they begin to start to feel very distressed. And we often, we get to a place with students who are really in need of a lot of help, but they haven't ever been seen because they find it to, from the perspective of their culture or their identity, they see asking for help as a sign of weakness or a sign of family shame, I would say.
So for me, since an adolescent, my mom has shared that there is a lot of mental issues in my family or so, but I wouldn't say it changed my mind. It just kind of made me have a different understanding. Like some people treat their mental illnesses and accept it in my culture, but some people kind of are against it and against treating it. Like they believe it's all in your head or, you have to be stronger. So for me, my mom was really supportive, but then there's also other people who just really wouldn't understand. So it was a little harder to accept, but I guess I realized that it was real, and in order to succeed, I had to recognize it.
So my identity shaped the way I view my diagnosis because I'm Armenian and there's not much, it's very traditional culture. It's not much spoken about mental health, or it's kind of keep it to yourself and don't tell anyone.
So my culture, the background of my culture is particularly I'm mestiza. I identify as mestiza, which means that I'm mixed. I'm mixed indigenous and also white. So from my paternal side, I am white via Mexico, via Spain. And on my indigenous side, it is from Bolivia. I am Quechua. And so the combination of these two is what we know in the US as Latinidad, right? Ser Latina. And there's a lot of influence from the Catholic Church there. I grew up Catholic, and what many Catholics might say is that there's a lot of components around shame and secrecy, especially Catholic Latinos when it comes to, speaking on your feelings or just talking about how you feel, especially coming from an immigrant household where I was first generation born here. There's no room. I was often told as a child, and this is to no fault of anyone, especially not my parents, because they were just doing their best, that, there's no time to be sad. There's no time to be anxious or scared. You got to do what you got to do. And you just had to move through it or not, and then suffer the consequences. And so there was a lot of compounded, unskillfulness in terms of my mental health conditions that I had to unlearn and work with in terms of learning what living with mental health conditions would be like in tandem with my culture and who I am.
Reflect on how your students with mental health conditions may be experiencing college life. how culture and identity shape the impact of their mental health conditions on their college experience, how this video may have impacted your view of teaching and mentoring students impacted by mental health conditions. The next video in this series will focus on how mental health conditions shape academic participation. Transitions ACR would like to thank the students, faculty members, and experts who shared their experience and expertise.